So today we are discussing about general anatomy of cardiovascular system. So cardiovascular system is the transport system of the body where the nutrients are required. It is a transport system of the body. Here through the blood the nutrients are taken to the places where they are required, and the metabolites are taken from the places and they are excreted to the places where they get excreted. So it is a transport system of the body, and it taken away the nutrients where they are required and taken out the waste products, and they taken out to the places where they are get excreted. So the medium is blood. Blood plays an important role in the transport of nutrient and taking out the excretions and excretes the waste materials. Okay, so the blood is the lipid medium, and the heart is the main one which maintains the circulation. The heart is the pumping organ which maintains the circulation. Okay, in the cardiovascular system we have heart is present. We know that heart consists of 4 chambers, 2 atria and 2 ventricles are present, and along with the heart the cardiovascular system also consists of arteries are present. Arteries, they are the tubular channels. They are tubular channels which carries the oxygenated blood to the different parts of the body. Arteries doesn't possess any valves. And coming to the veins, they like the tributaries of the river. These veins, small venules, they together forms the large vein like the tributaries of the river. They taken out the waste products as well as the deoxygenated blood from the body to the heart. So that's about the veins. And coming to the capillaries. Capillaries are the microscopic network of arteries, microscopic network which connects the arterioles with the venules. Other microscopic network which connects the arterioles with the venules. So CVS is the transport system of the body which supplies the nutrients to different parts of the body and taken out the waste products, and they get excreted to the places where they get, and they taken to the places where they get excreted. And the heart is the main. Heart consists of 4 chambers, 2 atria and 2 ventricles, and the arteries are the tubular channels. They distribute the oxygenated blood to different parts of the body from the heart, and the veins are the tributaries which collects the deoxygenated blood and waste products, and they supply the deoxygenated blood to they carry out the deoxygenated blood to the heart. And capillaries are the microscopic network of vessels between the arterioles and the venules. So these are the structures present in these are the contents of the cardiovascular system. Okay, and we can see 3 types of circulation is seen in the cardiovascular system. One is systemic circulation, and next one is pulmonary circulation, and the third one is portal circulation, Okay, in the systemic circulation, what happens here is the blood from the left ventricle, it enters through the arch of aorta. It supplies to the various parts of the body, and from the various parts of the body the deoxygenated blood again comes to the right atrium. This one we call it as systemic circulation. So the oxygenated blood from the left ventricle pumps through the various parts of the body, and the deoxygenated blood from the various parts of the body it reaches the right atrium. This circulation we call it as systemic circulation. Okay, and coming to the pulmonary circulation, the blood from the right ventricle, because we know the right ventricle consists of deoxygenated blood, right? The blood from the right ventricle passes to the lungs, and the lungs they purify the blood, and the blood from the lungs it opens into the left atrium through pulmonary veins. This circulation we call it as pulmonary circulation. So the blood from the right ventricle to lungs and lungs to left atrium, this is called pulmonary circulation. And portal circulation we can see in the liver. Here again in the blood here, the portal vein, it divides into branches called sinusoids, and from the blood here, from the sinusoids, it drains into central vein and further drains into hepatic veins. This portal circulation is seen in liver. From the portal vein, the blood again divides from the portal vein. The portal vein again divides into branches called sinusoids. From the sinusoids, again the blood is drained by the central veins, and the central veins together form the hepatic veins. So portal circulation is seen in liver. Okay. Systemic circulation means from left ventricle to the body and from the body to the right atrium. Okay, left ventricle to the body and from the body to the right atrium. This is the systemic circulation. And what is pulmonary circulation means from the right ventricle to the lungs, and from the lungs the purified oxygenated blood comes to right atrium by pulmonary veins. That is the pulmonary circulation. And portal circulation is seen in liver, where the portal vein divides into branches called sinusoids. From the sinusoids, the sinusoids they able to screen all the metabolites. They are able to screen all the useful products by the because the hepatocytes they are situated just from the side of sinusoids, and the hepatocytes they are able to screen all the useful material from the sinusoids, and the blood from the sinusoids they are drained to the central vein, and from the central vein the hepatic veins. This circulation we call it as portal circulation. And coming to the arteries. So arteries are of three. Arteries are the tubular channels. They have a small lumen and they have thick wall. Arteries have usually thick wall. They have a small lumen. Okay. And the arteries they further divide and divide. They form terminal arterioles. The smallest part of the artery is the terminal arterioles. Terminal arterioles. Okay. And from the side terminal arterioles, from the side branches of the terminal arterioles, again smallest division of arteries are seen, which are seen through our naked eye. We call it as meta arterioles. We call it as meta arterioles. So the smallest division of the artery is the meta arterioles. Usually the arteries divide and divide. They will divide in for last division is the terminal arteriole, and from the side branches of the terminal arterioles are the meta arterioles. Okay. So these are the, we can see through these meta-arterioles, we can see through our naked eye. Usually arteries, these arteries, they are divided into three types. Elastic artery, two types. Elastic artery and muscular artery. So in the microscopic anatomy, we will able to see tunica intima, tunica media and tunica adventitia. We have already discussed them during the histology. So in the tunica media of elastic artery, they have more number of elastic fibers. Okay, and in the tunica media of muscular artery, we have more number of muscle fibers, smooth muscle fibers are seen. So elastic artery example is common carotid artery. Okay, common carotid artery is best example. And also subclavian artery. There is the examples of elastic artery. Muscular arteries examples are occipital artery is the example of muscular arteries. Is the occipital artery is the example of muscular artery, and also we have facial artery. Facial arteries are also example of muscular arteries, because tunica media consists of smooth muscle fibers. Okay, and coming to the veins. The veins are having large lumen. They are having large lumen. Their walls are very thin compared to the arteries. Their walls are very thin compared to the arteries, and they have large lumen. Usually some space surrounds the veins because it allows the venous expansion. Some dead space present surrounding the veins. This dead space allows the venous expansion. Okay, so the veins further divides into venules. Okay, further these venules are not dividing. These venules together forms the small veins, and the small veins together forms the large veins. When we take the microscopic anatomy of the veins, we have more tunica intima and tunica media are very less. Tunica adventitia is more. Tunica adventitia is more, and tunica adventitia consists of more number of collagen fibers in the tunica adventitia, along with the longitudinal sections of smooth muscle fibers are seen. with the tunica adventitia of the vein. Tunica intima and tunica media are very less. Okay, so that's about the veins. And this, we know that capillaries are of two types: fenestrated capillaries as well as the capillaries are of two types. So capillaries are of two types: fenestrated capillaries and continuous capillaries. So continuous capillaries, they doesn't only the endothelial cells are closely arranged, they allow only small molecules to allow into the tissues. They allow only small molecules to allow into the tissues. The endothelial cells are closely arranged in the continuous capillaries. They allow only small molecules to pass through. Fenestrated capillaries they allow large molecules to pass through. They allow large molecules, they exist back between the endothelial cells, and they allow large molecules to pass through. Okay na? So this is the fenestrated capillaries and continuous capillaries. So continuous capillaries, they allow only small molecules to pass through, and the fenestrated capillaries, they allow the large molecule to pass through. And one more thing is sinusoids. So sinusoids, they are large irregular vascular spaces. Sinusoids are seen in liver. Sinusoids are seen in liver, and also sinusoids are also seen in the suprarenal gland. Suprarenal gland also consists of sinusoid, and spleen. Spleen also consists of sinusoids. They are the large irregular spaces which where they are in intimate contact with the cells of the corresponding organ. Thus the sinusoids, they allow the able to screen all the useful materials present in the blood. They are able to screen all the useful material present in the blood because they are in intimate contact with the tissues. These sinusoids are in intimate contact with the tissues. They are large irregular vascular spaces. Best examples of sinusoids are seen in liver, suprarenal gland. Okay. And one is anastomosis. The smallest anastomosis are nothing but the communication between, they are nothing but the anastomosis is nothing but the anastomosis. Anastomosis is the blood vessel, it combines with the another blood vessel, the smallest division of the blood vessel, whether it is maybe a venule or artery, whether or arteriole, they combine, they attach to the under the smallest division of another blood vessel. So these anastomosis is of three types: arterial anastomosis, venous anastomosis, and arteriovenous anastomosis. So arterial anastomosis, we can see here that the arteries directly unite with the arteries of the different arteries. For example, we can see in the palmar arch, here the radial artery combines with the branch of the ulnar artery. The radial artery combines with the ulnar artery. Here the arteries, they directly anastomose with each other without dividing into smallest branches. That is arterial anastomosis. And venous anastomosis, we can see in the plantar arch, and also we can see the dorsal venous arch is present here. The veins, they directly combines with the veins of the opposite side, that is called venous anastomosis. And here arteriovenous, in the arteriovenous anastomosis, the branches of the artery, they combines with the branches of the vein. What is the function of the arterial anastomosis? Means they maintain collateral circulation. In case of plantar arches and in case of palmar arches, if any occlusion of the artery takes place, then it may take another direction. That is, collateral circulation can be easily taken place. For example, but in case of heart, in case of coronary arteries, the branches of the arteries, the branches of the coronary arteries, they meet each other. So these coronary arteries, they are not be able to allow the collateral circulation, because if any occlusion occurs, if any blockage occurs in the one of the coronary arteries, the branches are very small, they couldn't maintain the collateral circulation, because the anastomosis occurs between the capillaries. The anastomosis occurs between the capillaries of the corresponding arteries. So that's why we cannot afford the collateral circulation. They cannot afford the collateral circulation, but they gradually allows the collateral circulation. But sudden occlusion does not allow the collateral circulation through the small branches of the coronary arteries. Okay. So that's about the anastomosis. That's about the CVS. And one more important thing, end arteries are present. Here the artery doesn't anastomosis with anything. So with any blood vessel, whether artery or vein, they are called end arteries. End arteries are seen. Best example is the central artery of retina. Central artery of retina does not anastomose with any artery or any vein. End arteries, they are nothing but they doesn't anastomose with any artery. Okay. These are called end arteries. Best example is the central artery of the retina. So that's about the CVS. Okay. CVS అయిపోయింది. నేను మధ్యలో ఒకసారి గ్యాప్ తీసుకుని చూసుకుని మార్చేసేయి. ఇక్కడ క్యాపిలరీస్ దగ్గర గ్యాప్ తీసుకుని. So today we will discuss about some of the anatomical terms. So first one is the supine position. Supine position means lying down, keeping the face upwards and keeping the palms like this. This is a supine position, keeping the palms like this, and this is a supine position. And prone position means lying down with the face downwards, lying down with the face downwards, with the prone position. And next one is the lithotomy position. In the lithotomy position, keeping the buttocks at the angle of the table, and the keeping the knees flexor, and this is the lithotomy position, keeping the buttocks at the angle of the table and the legs keeping the legs apart. This is the lithotomy position. And coming to the various planes, so this is the median plane. This is the median plane which divides the body into right and left half. This is the median plane. And the sagittal plane which is parallel to the median plane is called as sagittal plane. And this is the coronal plane. When we cut the body here and here, this is the coronal plane. And this is the horizontal plane, on the horizontal plane. And this is the parallel plane also. Parallel plane and horizontal planes are same. And coming to the origin and insertion, with the muzzle, the part of the muzzle which doesn't move during contraction, that is called origin, and the part of the muzzle which moves during contraction is the insertion. And coming to the belly, the fleshy part of the muzzle which undergoes contraction, that is called belly. And the non-fleshy part with the cord-like structure which doesn't undergo contraction, that is the tendon of the muzzle. And here we will able to see the anterior, towards the front is the anterior, towards the back is the posterior, and towards the median plane. So this is the median plane. Towards the median plane is the medial, towards the median plane is the medial, and away from the median plane is the lateral. And this is the radial border. Outer border of the forearm is the radial border, and inner border of the forearm is the ulnar border, and the inner border of the leg we call it as tibial border, and the lateral border of the leg we call it as fibular border. And we have towards the head is the superior, and towards the feet is the inferior. And one more anatomical terms are the ventral and dorsal. Ventral and dorsal similar to towards the belly is the ventral side, towards the back side is the dorsal side. And also we have cranial and caudal, like this is the cranial side, and this towards the tail is the caudal side, towards the head is the cranial side. Towards the head is the cranial side, and towards the tail is the caudal side. With these ventral, dorsal, cranial and caudal, we will usually discuss them during embryology. And ipsilateral means on the same side, contralateral means on the opposite side. And also we have flexor surface this is the flexor surface, and this is the extensor surface. In the In the legs, the back side is the flexor surface and front side is the extensor surface. So this is the flexor surface, this is called flexion, and this is the extension, flexion, extension. Similar, the opposite side is the lower limb, flexion, back side is the flexion, and this is the extension in the lower limb. This is the flexion in the lower limb, and this is the extension. This is the extensor surface of the lower limb, and this is the flexor surface of the lower limb. Here in the arm, this is the flexion and this is extension. Okay, and this is adduction. Adduction means towards the median plane is the adduction, and towards the median plane is the adduction. This is the adduction of the arm. This is the abduction of the arm. This is the abduction of the arm, and this is the adduction of the arm. And circumduction. Circumduction means together all the movements is the circumduction. This rotating the arm is the circumduction. Okay, and one is the, this is the pronation. This is pronation, and this is the supination. Pronation, supination. Okay, pronation, supination here, and these are the various anatomical terms we will discuss. We will come through this anatomical test while we are studying about regarding various parts of the body. These are the various anatomical terms we will useful. And one more thing is proximal and distal. Proximal means towards the trunk is the proximal, and away from the trunk is the distal. Away from the trunk is the distal, towards the trunk is the proximal. So these are the various anatomical terms. Oblique plane. Oblique plane means any plane of the above mentioned plane. Oblique plane means it is not horizontal plane, transverse plane, and sagittal plane. Oblique plane, any other plane other than the above mentioned planes is the oblique plane. It is not horizontal plane, because we know that above mentioned planes are horizontal plane, transverse plane, sagittal plane, coronal plane, and median plane. Other than that is the horizontal plane. So that's about the some of the anatomical terms you will be able to come across through during head and neck, and also during neuroanatomy. So that's about the anatomical terms. Shiva? Shiva, అయిపోయింది anatomical terms. తీసేసేయండి, నేను జస్ట్ కొంచెం 5 minutes